Marie slash Bama. That's Alyssa with Fuel the System podcast. Today we are talking about doctors and the system. Your doctor spent 8 to 10 years plus in medical school, and on average, they spent less than 20 hours learning about nutrition. That's less than a day's worth in 8 to 10 years. So think about that. That is less than 1% of their education is spent on nutrition. So we wonder why people are struggling with obesity, with energy, with chronic diseases, probably because they don't know anything about nutrition. Food is medicine, but it can also be sickness, and that's not what we want. All right. So I watched this documentary, and please feel free to chime in if any of this resonates with you, or if you can add anything to this. But I watched this documentary about a doctor who went to Stanford Medical School for 9 years. She graduated at 4 or 5 years, and then she went on to her subspecialty, which was surgery and ear, nose, and throat. And after 9 years, she quit. She finally figured out that all these years that she spent learning in medical school, 9+ years that she spent in medical school, she learned how to diagnose people. She learned how to cut into people. She learned how to medicate people. She learned how to bill people and then send them on and let the next patient come in. So 9 years at Stanford, and she quit because she realized that they weren't looking at the patient in a way of what is your overall health. They looked at the patient in a way of let's cut on you, let's give you medication, let's bill you and get you out of here. So that is where our system is really messed up. She still is a doctor, but I think she's more into her brother's a lobbyist who also went to Stanford, and they more advocate for people and that type of thing. Now, I think earlier this month, there's a new guideline that says medical students need 40 hours of nutrition in their medical training. That's still less than 1%. So it's still not helping. Is it a start? Maybe, but less than 1% is still not good. So like I said, it went from her not being able to look at a patient and say, what's your overall health, to she had to cut on people who may not have even needed surgery, bill them, get them out of there. I know. So just some statistics. Okay. 74% of Americans are obese, which is a lot. 50% of American adults have type 2 diabetes or are pre-diabetic. In 1950, only 1% of American adults had type 2 diabetes or was pre-diabetic. Now we're at 50%. Alzheimer's and dementia are going through the roof. So that has increased 3 times since 2012. Alzheimer's and dementia has increased 3 times since 2012. This is all because of our food. All this is going to go back to the medical field, but this is all because of our food. 1 in 2 Americans are expected to have some sort of cancer with all the stuff that we put in our food. Cancer in America is going up. So it's at 79% of Americans have cancer or will get cancer. That's went up in the last 10 years. Autism rates are continuing to rise. Infertility is continuing to rise. Autoimmune diseases are continuing to rise. They rise about 13% every year. All right. So again, food is medicine, but it's becoming sickness. And I have this conspiracy theory. It's completely a theory on my own. I don't have anything to back it up, but I don't think I should say this, but I'm going to say it anyways, is that I think, so I'm going to say this and it's going to seem like we're going off topic. I promise it all goes together. In the 1970s and 1980s, cigarette companies were making a killing. By about mid-1980s, it became widely spread that cigarettes were causing cancer. So cigarette companies started very quickly seeing their profit drop. So 2 of the biggest cigarette companies, it was Philip Morris, who manufactures Marlboro, and then R.J. Reynolds, who manufactures Newport, Pall Mall, Camel. They bought 4 of the biggest food companies. Philip Morris bought General Foods in 1985, and then Kraft Foods in 1988. And then R.J. Reynolds bought Nabisco and Del Monte in 1985. And they basically took their huge team of researchers and scientists, and they said, I need you to make this food addictive the way that you made cigarettes addictive. And that's where we really started seeing the turn in our food. These companies started making a killing again by making food addictive. And even now, I forget what it's called. It's like salt factor or something, but there's some sort of equation that food companies have that their food scientists follow to make foods addictive. So if you take something like Lay's potato chips, their slogan on the bag, it's on every single bag, says, bet you can't eat just one. Literally because they made it so addictive, you're going to eat half the bag, not realize that you ate half the bag, and not even feel full because there's no nutritional value. And now it's causing all these different illnesses. If you take other things that we have in the US, high fructose corn syrup it's not illegal or banned, but it's so highly restrictive in other countries, especially like Europe and UK, that most food companies don't even bother putting it in their food because it's too highly restrictive to try to get it in there. That's the same with red dye 40. It's the same with two different yellow dyes. I can't remember which yellow dyes. It's maybe 5 and 60, maybe, I don't know. But two different yellow dyes are so highly restrictive in other countries that food companies just won't even use them because they cause so many health issues. That's why they don't put them in there. That's why they're so highly restrictive. And there are other things like Mountain Dew and different cereals like Fruit Loops and Frosted Flakes and Kraft cheeses, probably Kraft singles if I had to guess, and just so many other foods that we have here in America that are just so easy to buy. You can buy all you want, are so highly restricted or banned in other countries. And then we wonder why America is so sick. And so going back to doctors is we have all that information and doctors can only tell you eat better. That's all they can tell you. They can't give you any other guidelines because they don't know. When they learn about food, they learn very basic, like what does the FDA say about food? Which don't even get me started about that because the FDA is like women should have 50 grams of protein a day and men should have like 70 or 80. And that's really cool to like survive, I guess, but you're not going to thrive on it. And doctors say eat better, and then they just give you a medication. And then the problem with that is because they're not looking at any underlying issues, they just say, you can't control your blood pressure. Let me try you on this blood pressure medication. And then the patient comes back and they're like, hey, it's causing this side effect. And they're like, okay, let's trial and error, take you off of this hypertension medication and put you on this hypertension medication. They come back, I think I'm allergic to this one. I got hives. Okay, let's take you off of this hypertension medication, put you on this one. And that one is controlling their hypertension. But now they're having this side effect, and the doctor is going to say, well, since this one has controlled your blood pressure the best, we're going to keep you on this, and then we're just going to put you on this new medication to deal with those side effects. And it becomes this spiral where now this patient is on 10, 15, 20 different medications. And the actual issue is most likely their diet that's causing all these things, and that's not getting fixed. Instead, we're just covering it up with Band-Aids. We're covering up hemorrhaging with Band-Aids. Doesn't make sense. And so I don't know if there's anything you want to add, but if not, I think this is a good point. We can kind of talk about our stories on what we've experienced.
Yeah, I mean, I agree with a lot of, well, everything you've said. One, because it's facts, but also, especially going back to the whole dementia and, Alzheimer's and things like that, that actually starts when you're in your 30s. So, ironically, whatever you're eating in your 30s or whatever it may be, whatever you're putting in your body then is going to affect your brain later. A lot of people think that dementia and stuff starts when they're old. It doesn't. It starts when you're in your 30s. So, it does make sense that most people they are starting to get dementia and show signs of that. So, that is interesting. So, I did want to put that in there. But yeah,
Yeah.
I mean, all the yellow dyes, red dyes, I veered off on my own for Valentine's Day, and it was the worst decision because I don't
Yep.
eat any of the stuff anymore, and I literally got sick after that. So yeah, and chocolate.
It's
It was made
crazy
up of.
that
It was black chocolate. Yeah.
it's crazy how
Why?
like
Why you putting red and yellow?
it is crazy how I eat so clean now that when I allow myself to have something, I don't know, I go to Starbucks and get a chocolate chip cookie. It tastes so good while I'm eating it, but almost immediately I feel sick, I feel sluggish. It really affects you. And people are eating that stuff every single day. They don't realize that it's affecting them because they feel that way all the time. So they probably think it's normal, and it's not.
I like that you said that because I feel the same way as you do because I eat very, very clean regiment. That's just who I am. That's how I have to function with Lyme and everything else. So as soon as I veer off, I will feel it. And if I don't feel it that day, I'll feel it like a day or two after. So the next day I'll be super sluggish. My brain will be foggy. It'll be the whole thing. I remember what it's like to feel bad, and I'm pretty good all most of the time. So when I do start to feel bad again, I'm like, oh no, I don't want this again. I don't want to feel this way.
But so just kind of going into our stories. So my stories are not much. I'm sure you have a lot of to your story with all you've been through. So for me,
Yeah.
I'll tell you about my experience and then kind of what my dad went through. It's kind of fitting that we're recording this episode on the 7-year anniversary that my dad passed away. We're teaching you, you said this in the first episode, like advocate for your body, advocate for yourself. And that's completely true. If I don't get to the doctor like ever, unless I have like some sort of sickness that I just can't get rid of on my own, then I'm like, all right, I need steroids or antibiotics just to knock this out. And then that's it. I hate taking medicine. And if I were to go to the doctor and say that I was having chronic joint pain or my blood sugar keeps dropping and I don't know why and all these things, if the first thing they try to do is put me on medication, I'll probably leave. If they're asking me about my diet, my exercise, my sleep, my hydration, okay, I will stay. Let's talk. Now I know I have a good doctor. But doctors just don't do that nowadays, and they're not taught to. So my experience with doctors is not much, but it kind of goes into that. You need to go see this specialist and this specialist. So my senior year of high school, this is such a stupid story. Me and my best friend were fishing for tadpoles at a creek, and we went to go hop over this puddle. And she hopped over first and she slid a little bit. And I was like, ooh, don't slip. And literally jumped over, hit the slickest spot ever, and then hit my head on the concrete. I think I blacked out for a few seconds, but then I had lingering issues of like foggy, like brain fog and dizziness and nausea. I couldn't shake it. And I tried, this was probably a week before I started my senior year. And so I went to school for about a month or two, but every day I wanted to not go to school, or I would go to school late, or I would call my mom and be like, please come get me. I don't feel good. And so then we started going to the doctor just to see what is going on. Why is she feeling dizzy all the time? When I would lay in bed, I would feel I was on a mattress in the middle of the ocean, just swaying, and I was laying completely still. And we went to a doctor almost every single day for like 2 weeks before we got an answer. And it was like, this doctor would check my blood. The doctor did a CT scan. This doctor checked my urine. They did all these different tests. And then finally, this one doctor said, here's what I want you to do. I want you to look at me. Look all the way to the left. How does that feel? Look all the way to the right. How does that feel? He had me look all the way down. How does that feel? He had me look up. I almost fell off the table because I got so dizzy. And he looked at me. He said, I think that you have vertigo. So I went to all these specialists just for the doctor to say, I think you have vertigo. That's great. So then he sent me to an ENT, and they did all kinds of tests. They did a beep test where I had to sit in this dark room, and every time that I heard a ringing, because I was having ringing in my ears, every time I heard ringing, I had to click a button. And I didn't know if I was hearing ringing in my ears or they were doing it. And then I had to sit in a dark room, and every time I saw a light flash somewhere, I had to press a button. And then there was another test. I can't remember what it was, but I was, why are we going through all these tests? Like, what are we doing? All for them to say, yeah, I think it's vertigo. And they just put me on basically a motion sickness medication. And it didn't help. I'm, all right, I'll just kind of live with this.
Mm.
And I did. I just lived with it until eventually it got better. They tried to tell me, you can at least do these exercises where you lay down on your side and then you do this, or you can do eye exercises. And I'm like, the eye exercises make me dizzy. That's the whole problem. So that's kind of my experience. It wasn't it wasn't very invasive, but it was still, I was going to see this doctor and this doctor doing this test and this test and this test, all for one doctor to say, yeah, you have vertigo. And that's all it was from my head injury. And this was a whole thing because I dropped out of school that year because I just couldn't do it. They wanted me to go see a counselor because they were like, are you getting bullied? Is that why? And I'm, no, I don't feel good. And it gave me anxiety. I had really bad anxiety. And they wanted me to see all
Mhm.
these people. And I'm, this is not helping. And I can't explain to you how I'm feeling. I just don't feel good. And it is all vertigo the whole time. And I don't know if the anxiety just came along with it or if it was just seeing all the doctors and not knowing what's going on. And just, I kind of did have days where I was, am I going to make it? Am I okay? I would lock myself in my room My mom would try to get me out of the house because she didn't understand, but she would try. And she would take me to Walmart, and she would get so upset with me because we'd be in Walmart and I'd be like, can I please go to the car and just be in the car, because I would get dizzy, I would get anxious, I would get nauseous, and I just needed to get away. And I just kind of lived with it until I didn't have those issues anymore because no one helped me. And then I get that's my story. So my dad's story is, I mean, it's worse. So in January of 2019, he was diagnosed with terminal kidney cancer. But what not a lot of people know is that in December of 2018, he had been rushed to the emergency room. They took him to one hospital, and that hospital looked at him and said, "You just have a virus," and they sent him home. And I truly believe it's because he didn't have insurance. And so they just didn't want to deal with that with someone who might not be able to afford it, whatever. And then a week later, he goes to another hospital emergency room where they were like, "You have cancer, it's everywhere. So now our job is to figure out where it's coming from." So, how could we have these doctors over here say, "You just have a virus," and sent this man home? And then a week later, he goes to see another hospital, and those doctors are like, "You have 6 to 12 months to live. Your cancer is everywhere." And it's like, just that's the system that we are in. And I mean, he didn't have 6 to 12 months to live. He had not even 2.5 months to live. But like, that's just what the system is like. You have some doctors who they might not want to deal with it because they're not going to make a profit off of it. You have doctors who maybe they're good, but they just don't know anything about nutrition. They only know how to diagnose you and take care of that specific problem. And that's what's wrong with our system. Our system is completely broken. It's crazy.
Well, yeah, and that's a lot. And it's if they would have maybe just talked to him more and try to figure more out than what they did instead of just send him home, it's a virus. I mean, maybe something could have changed a little bit to at least extend his life a little bit,
Yeah.
or even mention, a lot of things that are going on right now is like keto diet for cancer, because they're finding that sugar is literally the cancer cells. So
Crazy.
there's so many things. And then going back to your vertigo, that's insane. And but I don't know why no one didn't just say like the crystals in your ear is just off, because that's what it is. You have those little crystals in your ear, and when they're off, even by a tiny hair, that's why you're dizzy all the time. And there's actually a thing I went through the same thing with the vertigo, and it's interesting because there's a really weird hat. I don't know if you've ever seen it. Megan made fun of me for it, but I bought it. It's called the Dizzy Fix, and you put it on, and it has a long stick, and it goes out to a T. Like it goes out and out like this, and you literally lay back on like something, maybe like a rolling foam, and you tilt it until there's like a ball of liquid, and it moves until it centers. And when it centers, then your ear crystals are centered again.
That's crazy.
Crazy. Did you know that?
No, I didn't.
Yeah, so it's as simple as something like that. And the only reason I know that is because the first symptom I ever had with the whole COVID and Lyme stuff was a vertigo. And no one could help me. They gave me motion sickness pills as well.
Yep.
But going back to your dad's situation, that is something that is so common that I see nowadays, where it's just there are people that have cancer and they're going through all these chemo, which is even harsher on the system because you're essentially killing everything, and it's not giving them a chance to even fight. And now you're ruining your whole microbiome, and it's a hot mess. I wish doctors cared more about fixing and solving the issue than putting a band-aid on it. I guess that's where I get frustrated, because when it comes to your kidney, the kidney is obviously it's your detox pathway. So something happened. Something between then and then happened where it just wasn't functioning properly, and it started attacking and spreading,
Well, talking about that
Sorry.
diet, all he did was he drank Coors. It's okay, yeah. He drank Coors Light every day, which, first of all, that's the nastiest beer of all time, in my opinion. And he ate fast food all the time.
Yeah.
So his diet wasn't good.
No, his diet wasn't good. And if someone could have been, try this, it could have maybe just helped him a little bit, clear some stuff out, But at the same time, people are grown and taught a certain way of living, and that's how they always were raised and live, and in the environment they grow in, which is why I think it's also important as adults when you have children to teach them what to eat and what not to eat. Bring them into the grocery stores, show them what the fillers are. You should be preventing. I think this is where holistic comes in, and where it separates from Western medicine is it's all about preventative. We, as like holistic teachers and stuff, have to go in and help fix the issue because Western medicine doesn't help prevent it. But if you've gone holistic first, usually they help you prevent it. They kind of fix you, you detox, you do everything, then you prevent it. And I think if you were to use Western medicine and Eastern medicine, which is what holistic is, like they used to do, and combined it, things would work. But they don't want that. They don't, a lot of people don't want that. Companies don't want you to get better. They want you on the drug. That's my feeling on that. I mean, for anyone who has Lyme or an autoimmune disease, if you don't have a team of people that are helping you, and that team needs to have your best interest at heart. So if it's a Western medicine doctor that allows you to do Eastern medicine, but will check your blood work monthly, keep that doctor. Keep that doctor, because that doctor is helping you and keeping you on track, right? And then having somebody help you with physical and something with, nutrition, eating. It's a team. It's not, you're not going to have one doctor solve all your issues. It doesn't work like that because they're not specialized in all these different areas. They're just not.
So I guess before we go into your story, I do want to just say we're not knocking doctors. We're knocking the system. My dad did have a really good team of doctors that took care of him when it was time to take care of him. And the rest of the journey was as good as it could be when it came to doctors and nurses that took care of him. So we're not knocking now. We're just knocking the system. It sucks.
Yeah. 100%. The system doesn't give doctors a chance. They don't give them the chance to look at patients for a long period of time, which goes into, 10 to 15 minute doctor visits. So I guess that could segue into my story, right? Because as I said in episode 1 with all the Lyme and all the PCOS and IBS and all that stuff, 10 to 15 minutes at a time I was allotted was not enough to figure out what was going on. So being sent to different specialists, to another one, to another one, to another one, caused me, one, a lot of emotional stress. So I wasn't healed in that sense. And then I didn't have a chance. No one ever looked back in my history of what I took and what I didn't take of even the drugs. No one even looked in the history. Oh, you were on this amount of time. Or they say they do, but then they're just like, no, they ask you these questions, right? You go in, they ask you, what's your height? What's your weight? Let's take your blood pressure. Are you allergic to anything? Those are the 4 questions they first. Oh, and are you pregnant? Those are the 5 questions if you're a woman or whatever you are these days with men. Oh, anyway, so 5. Those are the first things they ask you. And then that's it. The nurse person leaves, then the doctor comes in, right? So you're in the doctor's office. They do everything. They just ask you they're asking you just questions that you've already answered with the nurse. And then they're just like, okay, well, what's wrong? And you tell them what's going on. And they automatically go, well, let's try this antibiotic. Or I don't know about you, Bama, before I get into any kind of tangent, I'm trying not to, but I don't know about you, but when I go in there, they're just, the doctor, the last time I went to the doctor's office for a sinus infection, didn't even feel my throat, didn't check my ears I told her that my ears were clogged. Didn't check my ears. I told her my throat was sore. Didn't check my throat. Checked my heart and my lungs. And then said, okay, we'll give you an antibiotic. I mean, I came in with an earache. You know what I mean? That's what makes me angry. Because there are doctors that don't care. So, and there are doctors that do care and they can't do anything about it, right? They're just stuck in the system of what they're working in. And they got bills to pay too. I don't blame them. Now they have medical debt. But at the same time, these are people's lives, man. If people cared about how they cared about animals as they do people, it'd be a whole different story, right? Look at it that way. Think about it. Yeah. People don't. They just don't care as much. It's just strange to me. So, I don't know, maybe it's a society thing. So, my story, I'm just going to do, I'm not going to go all the way back in time. I think we are well aware of the fact that I was passed on to many, many doctors and misdiagnosed my whole life. So, we already know that. I did have something come up recently where I had the sinus infection. I had a very bad virus in December. I could not get rid of it. And then it turned into this weird sinus thing. The sinus thing turned into this weird throat thing going on. So I started feeling dysphagia in my throat, which is where you feel like there's something in your throat, but there's nothing there. It's just muscles or nerve tension, whatever it may be. So I went, they told me I have to go to an ENT. I go to the ENT. They do the up the nose, down the throat. They say everything is perfect, voice box is perfect. Meanwhile, I have literally, if I were to look in the mirror and shine a light on my back of my throat, you could see that there's little bumps in the back of my throat, the old bump, which usually means tonsils, stones, or something like that. So it's how do you miss things like that? So I had a bunch of stuff going on. They didn't give me antibiotics this time. They told me to go to a gastroenterologist to go check my esophagus because they think that it's acid reflux, which I told them I really haven't had any acid reflux. I didn't go to the gastroenterologist. Why? Because I've been to the gastroenterologist twice. No, more than twice in my life, but twice. And the 2 times that I've went to them, they made me do the upper endoscopy, and 2 times they found absolutely nothing. So they found one polyp in my stomach, which was made from not H. pylori. It was some kind of gastritis, right? But it was a past gastritis that I had that no one even knew I had gastritis until they looked in, and it was already too late. So I just couldn't do it anymore. I don't like invasive stuff anymore. It's just too. You just run around and asking questions when it comes to your gut is just with doctors. It's not a realistic thing anymore for me. I don't think they understand it, which goes to the whole nutrition. When I do go to doctors and I'm dealing with something like IBS, I will go back to that, is the first thing they ever recommended to me was the low FODMAP diet. Have you ever heard,
I've heard of that.
I'm sure you know what the low FODMAP diet is. Yeah. I'm pretty sure about 98% of people that go on IBS get told to do the low FODMAP diet. That's the first thing they tell you to do. I'm pretty sure of it. And they give you the paper, they tell you to go home, they tell you to try it, and hopefully it works. But then they also give you, whatever they can to help your gut function properly, right? The problem with the low FODMAP diet is you're missing like essential nutrients. So it cuts out a lot of good things for you. That was my problem with that. Then when you're sick, they tell you to do the brat diet, right? When you get really, really sick and you can't eat and then you want something bland. My problem with the brat diet is that they suggest is that it's all crap, bread, which you're not getting homemade fresh bread you're not there baking bread, you're sick, okay? You're going out and getting whatever. Back then it was Wonder Bread. So don't act like you didn't have that. And then what is it? Rice. I mean, rice is a ton of carbs. Your body doesn't want to be more inflamed, okay? And rice also has glyphosate in it, so let's go there. And then applesauce, which whatever, you want to buy the applesauce that has the sugar added into it and all the other additives. Sure, unless you're at home, just shaving the apples, putting them in, which I know you're not. So maybe if you're Amish, and because you don't have time for that, no working family has time for that. And then what is the tea? The tea is what? I don't know. Brat diet. It's like tea. What is it for?
I don't remember.
I don't even know. I know it's protein. Chicken, turkey, whatever the heck it is. It's for something else. I think that's the stupidest diet to ever tell somebody that is sick. And I'm going to tell you that because I just think all of those things together are inflammation, right? That's like when you go to a hospital and you're in there and you have diabetes and they're giving you Jell-O and they're giving you, I don't know, a bunch of stuff with a bunch of sugar in it and carbs. And you're like, okay, but aren't I supposed to be getting better? And why are you giving me this? And I could say that because I worked in a hospital. My fiance works in a hospital, and she tells me this is what they give people. They give them, carbs. They give you a sandwich with turkey, is it because they're trying to keep you going? But you don't give that to a diabetic, right? So I don't believe in those kinds of diets. I think we're just okay here. Go ahead and it works for most people, right? So next time you're sick, you get really sick, boil some chicken, do bone broth. Do some rice, but very limited, small amounts, and then do some sweet potatoes. You know what I mean? Do something that complex carbohydrates, things that will fuel your system and make you feel better. So there's a tip. That's a good tip.
It's a good tip.
What do you think about that tip? Right?
It's a good tip.
So I like that. I figured there's a guy that created one of them called Curbs. I don't know what the U is, but the U is a Japanese plum, but he also believes in that, the boiled chicken and then the bone broth. And he's a chiropractor and very well known. Dr. Brandon Lundell is his name. He's you actually have to wait. His waiting list was in 2016 was 2 years to get him to take care of you. And he does all of it, functional medicine. So I do want to talk about good doctors. Even though the system is broken for most doctors, a lot of doctors that are not recognized or people don't actually use, which they should use at a young age, are chiropractors. I really think they're underrated, and I'm going to tell you why, because this is from literally 2 days ago. I went to go see my chiropractor. So I was having the problems with my throat, the dysphagia and everything, sent around it to 3 different people. It was insane. No one could figure it out. So I go to a chiropractor. Her name is Dr. Nina. She was with me for like 30 minutes, which usually 30 to 40 minutes, which is unlike a chiropractor. It's usually 10 to 15 minutes, or usually 15-minute increment. And I was having trouble with all this throat stuff, and she's okay, let's look at a few things. So she uses a thing called kinesiology, where she'll put your hand on like one part of the body part that doesn't feel right, and then she'll push down on your arm, and they measure the muscle tested when you lift up and down, right? So she tested me for my jaw, and my jaw was completely out of place. Okay, it was off to the side. She goes, "You don't feel that? Your one side's going up faster than the other." I was like, "No, I didn't even know." And then she said the hyoid bone, which is right here, it's a free floating bone. So it was pretty crazy, dude. So my hyoid bone was out of place. And it's a free floating bone, by the way. So, like, the fact that she even had to move it was crazy. And then I also have a slight hiatal hernia, which I didn't know I had. And she was like, honestly, even if you would have went to a gastroenterologist, they wouldn't have seen it because it would have to be such a big hole for them to even do anything. But so at that point, your stomach's just like, oh, that was bad. But up the stomach, you know what I mean? So that would have been really bad. She was like, okay, let's bring it down. So she made me stand up, and then I had to take a deep breath, and she hooked her finger down and went and pulled my stomach all the way down. And it was very painful, but it definitely moved. So, why am I saying all this? One, it definitely made me feel better, so that's good. Energetically, they're synergetic doctors. In other words, they make sure everything works cohesive and in line because everything feeds off of each other. So going to a chiropractor, you have these things that are a lot different than when you just go to a regular doctor. It's almost like when you go to a therapist and the therapist is like, okay, thank you for talking to me, but here's your prescription. Hopefully you feel better. The chiropractor's like, let's fix you, work on you right this second, and then see how you feel after. So I do think that chiropractors are way undervalued, and they should be valued more. So when we talk about good doctors, I believe chiropractors are really good. Now, also, they could do a functional medicine approach, and they do believe in nutrition. So, that's a really good sign for good doctors, right? So that's my like 2 cents on what my story is like. And I do think it's kind of ironic that we keep having these lapses while we're talking about doctors and how bad some of them are.
That's true.
That's probably the government being like, we can't have them do this.
That's bad.
So yeah, if you believe in science, kinesiology, what else? If you believe in all that, chiropractors are really good place to start. So they don't order the right blood test. But I guess that would be another topic as well with the doctors is they don't ever check what they need to check. So they should be checking for your vitamin D levels. They should be checking for your B12 level. They should be ordering you a CBC with differentials. They should be ordering a metabolic panel. If they think there's something wrong with your thyroid, it should not just be a TSH. It should be a TSH with T-free 3, T-free 4. There should be a lot of different tests that they ordered, and it seems like a lot. Even the Anascreen titer will show if you have an autoimmune going on at that time. So if you're getting checked for Hashimoto's or something like that, they'll usually run the Ana titer. So those are really good blood tests to know about. A lot of people, you just get the CBC and the metabolic, but they don't order the differentials sometimes. Differentials are the ones that will show sites, which is if you have a viral load. So people with EBV or chronic viruses, they'll show that. Sites will show if it's high, you have a virus. If it's neutrophils, and the neutrophils are high, then you'll have a bacteria. So these are things you can learn or read yourself. And it should always be a 60-30 ratio, like so a 2-to-1 ratio when it comes to neutrophils and lymphocytes. Those should always be that far apart because if they're 1-to-1 ratio, then that means you have something going on. So and nerd. A metabolic panel. Yeah, I'm a nerd, dude. I'm a nerd. And a metabolic panel, it's sodium and potassium. I'm telling people this because when you go to the doctor, you want to advocate for yourself. You're going to be like, hey, Alyssa, I remember Alyssa saying this. It'll work. You go to get your metabolic panel done. Sodium, potassium. If it's low, adrenal gland fatigue. That means you're crashing at 2 p.m. Yes, women, you all crash at 2 to 3 p.m. I know who you are. I'm staring at you right now. Fluoride, kidneys, calcium, vitamin D. So, and if you have your T proteins and your global, I think it's like a globulin or something, if it's high and elevated, it could be leaky gut. So you can, and AST and ALT, liver. So if you have low or high elevated in any direction of that way, it's not normal. And the thing about blood work is they'll say you're normal, even if you're within the range of regular, well, you're not above the range of what they say. That's not an optimal range. There's an optimal range. If you're 30 and below in vitamin D, you're not getting enough vitamin D. So I just wanted to share that with you guys because that's something I had to learn myself, and I took a seminar on it because now I know how to read blood work. So, and I'm not a doctor, so there you go. And you can't sue me. These are merely
Someone's gonna have their blood
suggestions.
work in front of them and they're gonna be like rewinding and pausing and like listening to what you're saying and then looking at their blood work.
You should, as you freaking should, man. And then they're gonna be like, "Well, I saw this girl on this podcast,
She said.
but she said, but I quote." Oh my god, let me play it back for you. I'm just kidding, but but because people don't know, and it's so funny. You can read your own stuff, advocate for your own body. That's what we're
Yeah.
not taught. And I think that's the issue. Because if you take yourself seriously, then other people have to take yourself seriously. And how many times have you don't go to a doctor a lot, but there's a lot of times you go to a doctor. If you're not with somebody, you feel like you're not taken serious enough when you're alone, rather when you're with somebody else.
I have a good doctor that goes to our gym, so he's active and he understands the lifestyle, which is great. But I think this was a great topic to talk about because really advocating for yourself. Every day I work with people who, what medication are you on? They're like, I have a whole list, but I don't know what they are. What do you mean
Oh,
you're on
God.
15 different medications and you don't even know what they are? You don't even know. That's not
Nope.
good. Like, but like people aren't educated on this stuff. And so they just trust a doctor who has went to school for a whole lot of years thinking that they know all these things, but one of the most crucial things that they can learn is nutrition, and they don't learn that. And so
Nope.
they just give out medications like candy, and then these people are like, well, my doctor said that I need this medication, so that's perfect. I have people who they want to do nutrition with me and work with me on nutrition, but they're like,
Oh,
let me talk to my doctor first and see what they say. What do you mean talk to your doctor first? You don't need to talk to your doctor first for me to tell you to eat healthy and tell you how to eat healthy and teach you all these things. It's crazy. So advocate for yourself. That's the whole point. Advocate for yourself.
yeah. Yeah. There's the good, there's the bad, there's the ugly in doctors, but advocate for yourself. I think that's what we're getting at. I think that's understood completely now if you haven't already.
Yeah.
Uh, but, and this goes back to nutrition, right? So we know that they don't have a lot of hours. They don't have the time to even go over nutrition or even know what diet's going to work best for you because they don't have the time to even look into that. So we need to check our foods that we're eating, right? On a day-to-day basis, and helping our own clients.
For sure.
Anything to add?
No, I'm excited. I'm excited for this episode to come out specifically.
I'm nervous, excited, and also we said this isn't to bash doctors because if something does happen, we obviously believe in doctors. It has nothing to do with that. There's just more elements to it.
Yeah.
Just tired of it. Yeah. Just it's worse when the system fails you because you're taught these are authoritative figures in your life. You're taught to trust them, and then when you lose that trust, that's the worst feeling ever. So how do doctors gain that trust? Like, do you get that trust back from the patient? But how does the patient get the trust back from the doctor? That's what's going to be the next few years from now, trying to figure out because especially after all the whole COVID debacle and the stuff with IBS and being on these cholesterol pills and, so forth on it.
Yeah, we got this.
I'm telling you, it's the government. The meteoroid crashed in Ohio. That's what it was. The
They heard
aliens.
what we were saying and they were like, oh no.
Yeah, they're like, this ain't happening. But we're
These girls are
going there.
relentless. They just keep on going.
Yeah, and we're going there and we're going to hit harder and harder every time. So
Yep.
buckle up. Buckle up.
That's
We
right.
will get you.